like to introduce to you Taiji Miyagawa. Taiji is a third-generation Japanese American and founding member of PANA. He is a longtime activist in the fight against corporate developer gentrification and has worked for housing justice in communities such as Little Tokyo, Chinatown, Lincoln Heights, and Boyle Heights, including as a current member of the Save Our Seniors Network. Taiji will be sharing an overview on Asian and Pacific Islander American healthcare disparities and what the goals of tonight's event are. Please take it away, Taiji.
Welcome, everybody. Thanks to all who joined this event. We're really excited. Great turnout. Really excited to see representation from different community organizations, and I recognize some of the activists that have been involved in this fight. Really appreciate it for the leadership coming from the legislators who've also joined. I'm really looking forward to hearing what they have to say about this bill. I know there's people that are on the call that don't know a lot of information about this exciting piece of legislation that we're addressing tonight, AB 14 under the CalCare Act. I know some people that might not be familiar with it, are really here, have a good opportunity to hear from the authors. It's pretty exciting. It's not every day that you get to do that. But in a nutshell, the goal of this program, the title of it was Building API Power to Win Healthcare Equality. That could have easily been a question mark. Major healthcare reform, something that all of our communities need, is not going to be an easy thing to win. And we hope that this event is the beginning of an effort to extend the conversation to all of our families, our friends, our organization memberships, and deeper in our communities and across community lines, and building solidarity to build the grassroots movement that we need to win it. I'm going to jump into a slideshow so you don't have to see my pretty face for the whole time, and give you a little bit of background on what PANA's perspective is. It includes some slides from other work that we've done and how we're approaching this issue. So I'm going to try to move it along quickly. I didn't get enough time to edit them as much as I wanted, but here we go. So first of all, just for people that didn't take Asian American Studies 101, we've been here, Asian Americans, since the 1800s, primarily as a super exploitable source of labor. First, the Chinese immigrants, as some people know, helped build the railroads. Later, Japanese, and then Filipinos. And we were really one of the backbones of the development of the California economy. And if you look at the history, we've been raising this in the context of the current anti-Asian violence. This is basically how you could characterize our entire history in this country. It's been one of discrimination and racist violence in basically every sphere of life. And that's kind of the context that we're talking about things today. We're the fastest growing demographic in the U.S., 1.6 million of us here in LA County alone, 8.2 million across the country, and we're a really diverse community. It's hard to talk about Asian Pacific Islanders, as a block. I mean, we do so out of convenience because there's so many of us to name, but we're extremely diverse population. 2 of 3 of us came from are immigrants, basically, and one out of 10 of us are undocumented. That's an important point with respect to healthcare considerations. But when we talk about healthcare, which is a term we're all going to use all through tonight, what exactly are we talking about? And our perspective is that we have a lot of groups here from different organizations doing different types of great work in the communities on a multitude of issues. And our contention is that you can talk about pretty much all of them as healthcare issues, right? Climate crisis, obviously, is a health care issue. Rising temperatures around the world, typhoons, hurricanes in the Philippines, rising sea levels that are actually overtaking several Pacific Island nations. This is an extreme healthcare crisis. Housing is a healthcare crisis. Corporate developers coming into our communities and destroying low and very low income housing inventory, and rents being so high where a studio in LA is now like $1,800. A 1-bedroom is approaching $2,500 a month. For people like in Chinatown, for example, people that are making less than $20,000 a year on fixed income, this is not a good situation, and it is definitely a healthcare issue. Seniors having to choose between splitting their pills in half or making their rent payment. Unhoused people face extreme stresses on their healthcare situation, and it doesn't help when the LAPD and sanitation department confiscate people's personal property and mow down the only homes that they have. And just a side note, since we're talking about the unhoused, while we're the fastest growing demographic in the country, we're also the fastest demographic amongst the unhoused population in San Francisco and Los Angeles. One big challenge that we have in this movement is countering the model minority myth, right? Like I began the slide by talking about who we are and how many of us are here. And there's this mythology that, we're all crazy rich Asians, right? And it simply isn't the case. The majority of us are working class, and our income inequality and income disparity within our communities is rising faster than any other demographic. Environmental justice is a healthcare issue. Toxic refineries next to our communities, for example, in the South Bay and West Long Beach, the Filipino community, Carson, Gardena, are all subject to disproportionate amounts of lung disease, along with other nationalities and people that live in those communities. But a lot of people don't realize that API communities are often nearby these kind of toxic refineries too. Anti-Asian violence, everybody knows about that, is also a healthcare issue on multiple levels for obvious reasons. If you're facing physical violence, this is a huge problem. This has been going back. This is Vincent Chin's mother speaking back during the Japan bashing auto manufacturing competition with Japan days. We all know that the hate crimes are on the rise, and I'm just sharing this one right here because people have probably seen it. This is not what we consider a viable healthcare plan. When people that are victims of this racist violence out in the streets, their families have to start GoFundMe pages just to pay for the medical care that their families need after being, facing this violence. This is a big problem. Here's a big healthcare disparity thing. This was noted in the LA Times. Pacific Islanders in California are 3 times more likely to contract COVID-19 than white people and nearly twice as likely to die. 1 in 4 Korean Americans and 1 out of 5 Americans have no health care coverage. So our perspective on how we hope we can move the conversation into how we can win is a question of how to build grassroots power, because we feel that's the only way that we're going to be able to win the change we need. And it's been established in history, in the civil rights movement, in the anti-war movement, in the fight to have our histories taught in the schools through ethnic studies. And more recently, as we've been having to stand up against anti-Asian violence and in solidarity against police brutality of Black, Brown, and Native American people. So I'm really looking forward to the rest of the conversation, hearing the stories from our guest speakers and what our politicians have to say to help educate the audience about this exciting new AB 1400 Medicare-for-all bill for California bill. Thank you.
Thank you, Taiji.